I think, collectively we've been kind of right on this. And so really it's the forecast that connected fitness ultimately would be the gateway to digital health and in-person care as it continues to mature.
So the future of the traditional hospital, I've just got questions about it. And I'm not sure if I was a hospital CEO, if I'd be looking to build more, because I see just more and more care moving out of the hospital.
On the topic of consumer-centered care, I would move providers from a green light to a yellow light. And what I mean by that is I'm a bit concerned that hospitals and health systems are squandering their opportunity to become consumer-centered once and for all.
New choices, new players, new models of care. Consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 381. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about my next recommendation of industry leaders to follow, watch, read, and listen to on the topic of consumer-centered care. Who's next on the list? I'll talk about that. Then we roll on with our annual predictions series, one of our most popular traditions. This time, James Gardner joins Zain and me as we each share predictions about what consumer-centered care will look like. On to the awesomeness, y'all. Are you ready? Let's go.
Flava of the week.
Let's continue with my list of recommendations of people to follow, watch, read, and listen to in order to expand your perspective on consumer-centered care. If you missed my highlights of the Microdosing podcast and Health Populi blog, you can check those out in the previous 2 episodes. My next recommendation is the Life-Centered Healthcare podcast hosted by Ann Summers-Hogg, Director of Healthcare at the Clayton Christensen Institute. A lot of health leaders and innovators talk about disrupting healthcare, but what does that really mean? What does it actually look like in the field, and how does one actually do it? On each episode of this podcast, Ann Summers discusses the application of disruptive innovation in healthcare and covers late Harvard professor Clayton Christensen's other theories and their potential to transform our healthcare ecosystem. Check out some of their recent guests. Max Marchioni, founder of Superpower, explored how jobs to be done theory can be leveraged to make preventive, longevity-focused medicine accessible to millions of people. As longevity care soars in popularity, health consumers still have to connect the dots across various market offerings to gain benefits. She also spoke with Melissa Wirt, CEO and founder of Latched Mama, who discussed tiny habits to reduce loneliness, the need to simplify progress, and how to show up for somebody else. The human body needs connection like it needs food, water, and shelter, yet we're losing points of in-person connection in a tech-enabled world. And Blake Madden, founder of Hospitology, explored how generative AI can support and hinder human health, as well as some of the promising offerings that serve humans' desires for relationships, accountability, and community. When we think about how to best leverage AI in support of making health outcomes better, we should think about how to support humans, not replace them. So I encourage you to check out Life-Centered Healthcare on Apple, Spotify, or wherever you listen to podcasts. It's a great lineup. It should be considered required learning for everyone in the space. Let's share more podcasts, blogs, videos, and other content that expands our knowledge of what consumer-centered care is really about. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
Hey folks, this is one of my favorite traditions of this program, to have our annual predictions series. Some of my favorite episodes of all time, no joke. Some insights really come up here that get me thinking all year long, and I'm excited to do this with Zain and James. Zain, welcome back.
Hey, good to be here. I can't believe this is the 3rd, 4th predictions episode I've been a part of now. Time flies.
Yeah, it's at least the 3rd.
Yeah, I think we're on to the 4th.
And James, same with you. Welcome back.
Hey, James.
Good to see you. Hey, Zain. Hey, Jared. Excited to be back. Can't believe we've reached the end of another year, and we're boldly looking ahead to 2025 with cool and fresh and big predictions.
Yes. I feel like we need to, I don't know if it's through a blog or Substack, go back to the episodes, document what we said, and see where we're at. Because now we have at least, 4 years of predictions, and see which one of us was most right and most wrong.
You know me, Zain. I'm not a big fan of accountability. Come on.
Right. Part of me in theory thinks I'm sure I got a lot of them right, but I'm actually pretty sure some of them didn't land anywhere near what actually happened. So I do think we have some on tap though this year that we should just kind of dig right into that are a bit of an evolution or a departure from some of the places we've gone in the past or just further down those roads. What if we start with, I think we were going to start with me, but my first one's a bit of a downer. I'm not going to lie. So Zain, what if we go with you first? So we're just going to go one by one through each of us. We'll just keep going until we're out. But I think we each have a couple. And then that question about brands that we expect to be talking about the most. So we'll save that for the end. So stick around for that. But Zain, why don't you cover your first one, and then that'll ease me into my cautionary tale, I guess.
Sure. Well, mine's a bit of a positive and frankly, maybe a bit of a repeat from other years, but I wanted to bring it back to our listening audience because I think, collectively we've been kind of right on this. And so really it's the forecast that connected fitness ultimately would be the gateway to digital health and in-person care as it continues to mature. And so in my view, the trend is the intersection of fitness, and wellness technology is reshaping healthcare delivery. Not in a big way yet, but there's some signals we'll talk about here in a second. And ultimately, fitness and wearable technology companies are forming strategic partnerships with now, as we predicted, healthcare organizations to ultimately think about expanding their offerings and creating more seamless integrations between, call it the personal health data and hopefully the medical record, medical care down the road. What I'm also seeing in preparing for this episode is there seems to concurrently also be these like membership-based health optimization clinics that are starting to pop up. Usually they're hyper local. And so it's people who are usually pretty fit and healthy now want to go to the next level and say, how do I like truly optimize and not just get care plans to treat my issues, but like get me on the right vitamins, get me on the right supplements so that I can be the best human I can possibly be. So we're seeing those jump up. And then sort of related to this and also a little bit political is I've noticed there's a lot of influencers now and politicians, which we'll mention a few names here in a second, who seem to be good at drawing awareness from everyday Americans around just how big of an issue we're in as it relates to the wellness crisis related to diet and the impact of technology on the human condition. So I think all these things are sort of swirling together that are getting more average people excited and motivated about their wellness, not only their health, but like optimizing the human condition, so to speak. And so just some examples just to list off, and by all means jump in and comment. This one is close to home since we interviewed them, but Oura Ring. So Oura Ring announced their partnership with Dexcom, which is really, really cool. Again, I think year one in our prediction, we called that someone would do this eventually. And so they're working together. Now their solutions apparently will be able to flow between one another from a data perspective as Oura Ring dives into the metabolic health management space, which just happens to be the big space that these influencers like Casey Means and RFK Jr. and others are talking about, right? Also, Oura Ring launched their symptom radar. So it's more or less based on the data that's feeding through the ring, more or less able to alert the individual that, hey, you might be getting sick. I think right now it just focuses on like, hey, you have a cold or something minor. But in the long run, who knows what these tools will be able to tell consumers. And what I don't think they've done yet is now connected that to an actual care provider and say, hey, Jared, the ring's telling me you're sick. Why don't you hit this button and be connected with a physician over at, Amazon Clinic or Henry Ford Health or, Intermountain Health, whoever has their telehealth partnered with them. And so I think the broader industry implication here is probably like Whoop, Fitbit, Apple Watch likely will follow with similar data. Off the record, I've chatted with some folks at these companies, and they're well aware in their data science team that the data they're collecting on consumers is suggesting, is demonstrating that, someone might be sick. They're just not at the place, where they're willing to go public with it and get it FDA cleared. I don't know if it requires FDA clearance, but go through the hoops to actually turn that into a product. And so the story here is the data science is getting good enough now that, even if you're wearing a Fitbit or a Oura Ring, there's a good chance that it's able to tell you that there's something broader wrong with you, so to speak, than just how many steps you took or how many calories you burned. And so I think that's the opportunity then for either legacy hospital systems or medical providers to then partner with these wearable solutions, say, hey, when you identify that some of my patients or some of my users of my device are sick, how might we connect them to actual care? And so that's in my view then how connected fitness becomes the gateway to in-person care. And then just one more example then, and this actually comes through one of my colleagues. I work with Neil, who's very much a futurist too. And he was telling me about Superpower, which I don't know if you all have heard of it. It's this new clinic that just set up in New York, again, focused on health optimization. I'm not exactly clear how they do it, but I think there's a whole suite of digital tools and clinical tools, wellness tools, supplements, you name it, that will help people optimize their health. And within 2 weeks of their launch, they already had $800,000 in recurring revenue and over 145,000 individuals on the wait list. And so to me, this tells you that this whole sphere of connected health, wellness, for at least a certain segment of the population is very top of mind. And again, as this cultural momentum takes off with, RFK and some of these politicians who are really bringing this into the forefront, the issues, the intersection of big pharma, big food, and America's metabolic health crisis, I would imagine that all these tools in this whole space is just going to blow up in a good way. And so I see it as a good thing. And I think it's something that we've talked about on the show before. And so I'm proud of us that I think where we were thinking in the early days seems to be happening. And so curious what you all think about that.
First, big ideas. You've already got Jared and I on our heels as we try and bring equally significant predictions to the table. But I'm wondering, amongst many things, does this create a point of entry for some of the people on the fringe of the athletic or wellness movement? I'm thinking the Lululemons, the Nikes, the Adidas, Athleta, some of the sports brands that have hinted at an interest in moving closer and closer to wellness beyond just fitness.
I don't see why not. I mean, if someone can ultimately build a constellation similar to how health systems are doing, a constellation of wellness products, whether it's led by the wearable device provider or maybe the clinical provider that can then say, hey, here's all these other things you might be interested in. And I'm sure someone could hack into the consumer data and figure out that, maybe Zain is more apt or has a higher propensity to purchase Under Armour clothing versus Lululemon or Built or you name it. And so I think it's a huge possibility. But also actually, now that you bring that up, makes me think about, a prediction we've made before where we said, why isn't it that health systems, or maybe just a question we've asked on the show is, why aren't health systems working with bigger wellness brands like Lululemon, Nike, maybe sponsoring some of their service lines to start to bring more value than just the clinical service they provide? And so I think the answer is yes, and probably remains to be seen what the business model would look like.
You started us on a positive note, so I'm going to try not to bring us down too much on this, but these are predictions, right? It's just kind of where we see things going. I think when I'm looking at traditional care providers on the topic of consumer-centered care, I would move providers from a green light to a yellow light. And what I mean by that is I'm a bit concerned that hospitals and health systems are squandering their opportunity to become consumer-centered once and for all. And as a result, set the foundation for healthcare that people have been telling them what they want, how they want this to be experienced, and what will lead them to engage more in their health, see more healthcare professionals, get more to the point of feeling in charge of their own health instead of being absolutely frustrated and devastated by the consequences of their own health journeys. I just feel like health systems as a whole are starting to squander this opportunity. And one piece is, of course, it all comes back to the incentives, right? We haven't seen any incentives that I'm aware of that there will be change for the incentives that are baked into the sick care system. So that's the revenue base. They still reach revenue faster when more people are sick. That's still the basis of everything. And so while a patient experience initiative or a program or even a consumer experience or customer experience, for a number of years, there were more people with those words in their titles. That seems to have stalled, at least. I wouldn't say it's gone backwards, but it's stalled. And we're just not seeing signs of progress like I would have expected at this point. So it just feels like we're kind of spinning our wheels. I do think there's some natural reasons for that. I think some of the momentum gets halted a lot based on executive turnover and mergers and acquisitions that block initiatives that have to start the cycle over again from these, long strategic initiatives. These are typically initiatives that are on a 3-year strategic plan, 2, 3, 5 year. strategic plan, labeled there with all the other priorities of the health system. But when there's somebody happening, like somebody in the C-suite, one of those buyers or influencers in the organization is turning over every 6 months or more often, that just starts the cycle again. So you're kind of in a holding pattern. And we even get to the point where are we looking at a point in the future where we have to just wait for a generation of leaders to kind of like retire or kind of age out to see the kinds of changes that we would have expected to happen at scale? That has yet to be seen, but it begs the question of when I hear things like the innovation functions in health systems still having to fight a land battle, a turf battle to get initiatives off the ground, to just keep getting blocked by the same folks in leadership. And then even there's a trend lately of experienced designers and service designers in health systems getting laid off and just not even feeling like not even having necessarily more openings to apply to, just feeling they're like, I don't even know where to plug myself in to apply for the next job. That's happened recently. So I think we're floundering a bit as an industry on the sick care side. And then you do kind of usher in the thought of where does public health sentiment sit now and where could it go from here? Part of me feels like I had hoped that we were kind of getting past the initial era of misinformation out there in healthcare land. And I don't know. I don't know if that's a place, healthcare land, but I feel like we could be set for a new era of misinformation. And it kind of makes me feel like at the very least, we're headed down this road of eroding even more trust in navigating the system, which just leads ultimately to fewer people engaging in the healthcare system. So I do think the discourse in society, I mean, look, you're probably even going to bring it up later as my guest saying, like the Brian Thompson, the United Healthcare CEO tragedy. The public discourse on that has been so discouraging. I feel like we need to set some limits in our discourse as well for that. But that just kind of points me to, the public sentiment in general about the trust in the healthcare system. So I will say, I do think there are roads out of this. I just think we're not at the point where I would have expected to be at this point. And that's why I'd kind of move that to a yellow light. And I do hope there will be more signals. I think the direction that you were pointing to, Zain, on the connected fitness side is maybe this is impetus for that growth to just explode on that side. That's a super positive signal for me to think about.
Linking it to what I was talking about, obviously what I was describing is like very niche and not a huge section of the population. But as you were talking, Jared, I know from my time working in health systems and today working with health systems, I know a lot of executives, usually respond pretty well to seeing like market share data. And what I don't think is available that would actually encourage health systems to like try this again is all these disruptors. So you think about like Wheel, Hims and Hers, Amazon. I'm just thinking out loud here in my head. And maybe I'm not perfectly right on this, but I would imagine a lot of their number of users and customers isn't necessarily publicly available or purchasable like health systems who purchase market share data relative to their competitors. And so it could be the case that there's like this secret growth that's not necessarily visible to executives to make them realize how far behind they are. So I'll never forget when Miss Davy from Wheel, Michelle, who reminded us that the ethos we took in that show was that, maybe telehealth is dying, or, we didn't necessarily see the utilization numbers go back after COVID. But what she reminded us is a lot of the work that Wheel does wouldn't get reported because they're not accepting insurance, which made me realize, hey, maybe there's this whole hidden market, if you will. Like, do we really know how many Americans are using these new channels, new tools? And, final anecdote, I think I've mentioned this on the show. I live here in a condo building in Detroit. And now when I go in the package room, like 1/3 of the packages are from Hims and Hers. I didn't see that 2 years ago. And so at least anecdotally, some of these disruptors are really making a lot of progress. And again, I don't think it's visible from a market share data, just how many people in my market are actually using these relative to industry incumbent leaders. What do you think, James?
Provocative. And I like that mailroom data collection. Yeah, off the grid. Good for you. Now, Jared, are you discouraged to the point of like throwing up your hands? I know you, and I don't think that's what you're saying, but the yellow light is concerning.
Yeah, it's more of a reality check than anything, because in my mind, that helps in light of not having data sitting there, like to Zain's point of, well, the data says, like here's market share. That naturally compels, you to drive different market actions, based on your organization. Without something like that, I think we need a compelling event to get us to another place. And I don't know what that is. There aren't any signals that something's on the horizon that will compel health systems to get to a better place. We know they have the muscles to do it. They all showed it during COVID, how quickly virtual care was stood up. It's possible they can if they want to, if they feel like it. So I just think collectively, I think we need to just look in the mirror ourselves a little bit more. Absolutely not throw our hands up. I mean, I see myself spending genuinely like the rest of my career working to making progress in this space. So yeah, absolutely not giving up by any means.
Let me boldly throw out a thought. I don't know if it's a positive one either. So we're all kind of lamenting problems, but I wanted to talk to the future of the traditional hospital. And by that, I mean like the large brick and mortar establishments that we all know so well. And I'm just pondering the future of those institutions, the buildings themselves more than anything. And the jumping off point for this thought was an article last week, summing up some research from Bain & Company, which is a large management consulting firm. And they put out a prediction, so I'll build my prediction on their prediction, which is that by 2030, which is only 5 years in the future, they anticipate that 30% of primary care will be delivered by what they call non-traditionals, which is significantly higher than it is today. And by non-traditionals, yes, it's our favorites, the retailers of the world, which despite setbacks, they're still chugging away, but they're also thinking of payviders, which is probably a more significant force. The United Healthcares of the world, the Humanas of the world. And listeners of the podcast will remember we hosted Dr. Shetta from Humana, and he talked about taking over some of the clinics that Walmart was walking away from as they kind of build on a niche in delivering senior primary care. So the future of the traditional hospital, I've just got questions about it. And I'm not sure if I was a hospital CEO, if I'd be looking to build more, because I see just more and more care moving out of the hospital. And primary care is just one manifestation of that. But we've all been following, I think, the hospital at home concept, which I'm extremely excited about. Remote patient monitoring technology is allowing even acute care to be delivered at home in a very cost-effective way and in a way that patients generally prefer. So it's high-quality care preferred by patients, usually less expensively than in a hospital. Then there's questions about hospital at home, I understand. It can put a burden on a family member to take on that care responsibility, but all things being equal, when it's possible, it looks like it's a winning solution. So that's also pulling care out of the hospital. We're also very familiar with ambulatory surgical clinics, which are pulling surgeries out of the hospital and allowing people to do day surgeries and have less overnight stays. So there's a lot of tailwinds, if you will, taking care out of traditional hospitals, which are incredibly expensive places to deliver care and generally aren't favorites of patients. So I'm wondering if we'll see an acceleration of this in 2025. I think we will. I don't think it's like a new trend altogether, but perhaps we'll see more and more of it as people realize that this could be the future of not all care being delivered, but certainly more and more of it.
I think that makes a lot of sense. I think the challenges that I keep hearing in the market relative to acute care at home or health at home or hospital at home really just boils down to like logistics and familiarity. And so maybe I'll start with familiarity. So what I mean by that is health systems, are so accustomed to just delivering care within their four walls or an ambulatory center. I've just heard through people that are in that industry, it's very difficult, even when they're in a partnership with a healthcare at home agency, to get them to identify the right patient and bring them over into that program. It's almost like they're just on autopilot, like refer to a normal site of care as opposed to doing it at home. And so I think there still needs to be a lot of education there and the hammering out of workflows. And then the other complaint I hear a lot is really around logistics, because the moment you move out of providing care within your four walls, you, in a sense, become like a bit of a logistics company. You now need to take your care, your people, and your supplies into someone's home, right? And health systems have never been good at that, right? They almost need Amazon acumen, but really they're doctors and nurses. And so I think that there's some growing up that needs to be done there. But I do agree, I don't think it makes sense for health systems to give up that new segment of the market. For example, health systems who didn't invest in big ambulatory footprints back in the day are suffering today, right? All they have is their acute care organization. Where I come from at Henry Ford, they invested heavily in ambulatory care. They were some of the first in the country to have massive multi-specialty ambulatory sites, ASCs, standalone ERs, and it's paid off. Now probably the next step is, okay, go the next step and like get into care at home, which they're doing, but certainly there's opportunity for more. And so I think those two things are holding up the trend just a little bit, but hopefully we'll cross some chasm where finally health systems will understand, know how to do it, hire the right people, and assuming the payment follows, to your point, James, it should just blow right up in a good way.
Is this a good opportunity to think when we look through the lens of the consumer first? It feels pretty well established that not all use cases, not all treatments, not all diagnoses, but quite a few of them, in quite a few cases, people would still prefer to be treated at home if the option's there. And so if we look at that first, then that motivates us to find ways through training, through finding the right partnerships, through education to overcome those legit feelings right now of the staff, who are the ones who are being told, guess what you get to do now? And that is different than everything you've been trained on and you get to do it in addition to, so we can't ignore that. At the same time, it's a perfect example of if keeping both sides of it in mind so that there's progress. And so it is such a disruption to what most clinicians, I would assume, are used to and expect and are trained on. So it's such a valid point.
Yeah, if anyone's interested in learning more, the program at Brigham and Women's Hospital here in Boston is one of the most advanced in the country. And I think the last stat I heard was they've got the equivalent of 70 hospital beds that they can now deliver care through at home, which is remarkable. And your point about logistics is a great one. Obviously, listeners of the show know of our fondness for Best Buy Health, which has walked into this opportunity to deploy mobile patient monitoring equipment and other technologies at home and manage all the logistics to do that.
And this connects back. I know we've had Zipline on the call on the show. And, typically when we talk about Zipline, it's more around the delivery of scripts, but don't forget they can also deliver supplies. And so if you're, creating a hospital at home program, what might a partnership look like with Zipline to get the right supplies and scripts into someone's home, and then the care provider shows up to assist and administer? I think all these things will come into question. I don't think the best toolbox has been built yet, and the best model. I think there's still a lot more opportunity to improve what that model looks like from a supporting technology perspective.
I wouldn't want this last thought to get overlooked. Part of the move of care out of hospitals is also the pay-vider phenomena. And it's no secret of United Health's interest in delivering care that keeps people out of hospitals. And they're the largest employer of physicians now by far. Humana obviously has similar plans. Aetna has similar plans. They're very, very incented to deliver care in the lowest cost format, and that's usually not the hospital.
I want to find this clip because I recall you sharing a thought similar to this probably like 3 or 4 years ago about what the hospital of the future looks like and how if we move the paradigm to truly being where hospitals excel, which don't we all know, it's specialty care, it is saving lives, it's just about everything beyond primary care, which I'm not saying they're not good at that, but like they really excel. People are forever in gratitude to their care teams for that deep specialized care, acute care in particular. That's needed. That's where they excel. So what if that paradigm continues to change or continues to evolve, rather, it goes down the same road of like at some point, is that all a hospital is? Like all the other pieces we leave to these traditional and non-traditional players who got really good at offering a consumer-friendly version of primary care in any form, urgent care, whatever it is, ambulatory care, like whatever it is. And they've just focused on the inpatient side because it feels like they're trying to do that at the same time as everything else. And I'm speaking like everyone's the same. I'm painting with a very broad brush here right now. So disclaimer there. But yeah, it was a provocative thought back then in a really good way. And I just remember that. So I'm going to find that clip for you, James, at some point. All right. So let's see. That was round 1. Let's do one more round here. Zain, it's going to be back to you.
All right. Round 2. I think I can be quicker than last time. But my second forecast or prediction or peering into the crystal ball. This one might be a bit of a downer, but I think there's an upside, and it is that hospital systems increasingly, so nonprofit hospital systems, will increasingly need to prove their value to justify their tax-exempt status. And so maybe a little bit of background there before we go into this. And I think there's a tech component, so I'll try to get to it. But for those of you that don't know, in nonprofit health systems, I don't think it's every year. I think it's every 3 years. They have to submit something to the government called their community benefits reporting. And essentially, I believe it's primarily a financial document that demonstrates how the health system is delivering value over and above the care they provide to their customers or their patients to the extent that they should merit a nonprofit status, like they don't pay taxes, right? And so it's things like charity care. Even when I used to work in health systems, any time that I would serve on a board, I would submit to our finance team or regulatory team to capture that. And, they capture this all across the system and send it in. And I don't know that any health system has ever lost their nonprofit status yet, but it's a big piece of the pie, that's needed to be done every year. And usually that document in parallel is kind of worked on relative to their community health needs assessment. And so again, being able to go into the community and say, what are the needs here and how might we actually serve the geographic region in which we're a nonprofit health system as opposed to serving an insurance population. And so those two things are technically separate, but kind of in the same general arena that ultimately keep health systems in this nonprofit status. So I think what's happening, and we've been seeing this for a few years, is it appears that there's a growing perception that health systems are not necessarily meeting community needs effectively. And without naming names, some of the biggest health system brands in the world, American brands in the world, operate in extremely poor communities that have extremely poor health outcomes. Again, won't say their names. You can probably guess. So that's one piece. Obviously access and affordability and everything that we harp on here at the Healthcare App around consumer experience. It's not easy, continues to be pretty terrible, I would say, in general. And then recently, and again, not to get super negative, but, with the assassination of United Health CEO, and there's been some other, pings in the news, people are starting to realize that at the top echelons of both health plans and health systems, a lot of these leaders are making a lot of money. And then when you compare it to, high-level benchmarks of other OECD nations, you can see that the United States doesn't have the same, life expectancy as other nations, even though we're spending way more on healthcare than anywhere else. And so again, similar to connecting to my first topic around some of these social movements and temporal markers, people are waking up to this. And so if I was a health system CEO today, I would say, oh my gosh, we probably need to make sure we get our ducks in a row and make sure that the true story and true measure of the value we're delivering to our community is at our fingertips, that we can articulate it. I've not seen anyone, in government say, hey, we need to push for removing the non-taxable status of these health systems. But I wouldn't be surprised if we're not far off, where someone's going to start to make a stink and say, please show me why you deserve to be, not taxed. And so a couple of things that I think, if I was the CEO, the CFO, the chief strategy officer, compliance, I'd be starting to work right now to start to think very hard about how do I quantify this? Because typically when this is done in a health system, it's kind of done in a back of the napkin way. It's not dealt with in the same rigor that the strategic plan would or other financial planning would, because frankly, there's not necessarily a big policeman waiting to check. And then directly related to, I think, the things we talk about here, I do think there's a huge opportunity for technology to play a role here to really help health systems understand in what ways and how and to what quantifiable number are we actually delivering value to the community. And so, obviously data analytics, patient engagement tools, you name it, all can tell a story to the public at large on what is the benefit that we're actually bringing to the community. And so that's one that, I know it might be a little bit of a weird prediction, but I keep seeing it time and time again. And to, I think in the pre-show, your earlier point about all the outrage we've seen after the murder of United Health CEO. And frankly, and I think we know this, some people were pretty happy. They weren't, it just uncovered just how unhappy people are with the current environment. And frankly, it made me realize that, Mr. and Mrs. Average American actually is starting to realize sort of the game that we're in, where the funds are flowing and where they're not flowing and where they're not actually helping their community. And so I think it's something that, legacy health system leaders probably need to pay attention to and start preparing, because I would imagine in a couple of years, some may be held to account and say, okay, you tell me why this institution deserves to be not taxed, right? So I don't know. That's a bit of a rant, I guess.
I think you're onto something. Zain. I see a parallel in higher education here in Boston. We have a large number of universities and colleges that don't pay taxes, and yet, they're a burden on the city's infrastructure. And there's been immense pressure put on them, and they now make voluntary payments to reflect the burden that they place on police, fire, water, all the city amenities. And there's also been talk of taxing their endowments. So that hinges on their nonprofit status. So I don't think anyone can escape accountability on this one.
Right. I think you hit the nail on the head. It's really about accountability. And I think just getting in front of the cameras and saying, look at the new hospital we built. It's going to improve the care in our community. I think we all know darn well that those hospitals are ultimately built based on strategic inferences about very specific insurance populations and not typically for the community that's actually built in. And so I think people need to start, or health system leaders need to reframe how they communicate their value story, not only to their local community, but obviously the state and federal communities as well.
My second one, it has to do, I just want to expand on a thought from Jane Sarasohn-Kahn in her episode. Because Jane, for those who haven't had a chance to listen to her episode, highly encourage it. Jane came on with Amy Hammonds, and just as everyone knows from the two of them, the perspective is so well informed and so global and broad. For those who don't know Jane, she has dual citizenship in the US and the EU. And so she's able to bring a lot of thoughts around health citizenship. So we're referring to a health citizen as opposed to a patient or consumer. So it implies this responsibility piece of approaching your health, like your health affects the health of other people around you. But she also referred to the holistic primary care backbone in the EU that's easier to see there, because when we're just talking about that road to get a diagnosis and just understand where you are in your health journey, that part in and of itself it continues to be so hard to navigate here in the US. That so many things happen as a result of that. The on-roads for specialty care, for acute care, for once we get sick to a certain point, what happens at that point? That's all dependent on that on-ramp for being able to get a diagnosis, to understand your whole holistic picture of your own health. And it really just got me thinking, because Jane pointed to how having that in place, having that stronger holistic approach to primary care, which there's a greater sense of almost public health, like a public health approach to things, of like not just doing this to gain market share, like our approach to health affects yours, not just on an individual level, but on an organizational level, from providers and from non-traditionals, as we've referred to them. But having that in place and focusing on it, on the ability for primary care to not be so isolated and fragmented itself, lowers overall costs, it streamlines the pathway to diagnosis. And from there, then you're able to actually make a different set of healthcare choices for the most part. Clearly not everybody, and clearly it continues to be inequitable in the US. So there are aspects of it as well that help us learn where we can go with things. It just got me thinking, like, we, at least in the public eye, right? At least on social media, we still see such a focus on individual players, especially when it comes to non-traditionals, which, up until probably a year ago, I referred to as disruptors. And I've, taken a step back and said it literally just means somebody who they don't come from an integrated health system, essentially. But anyone else who's offering primary care in particular, like that's where this usually comes to the forefront. A number of the players we've talked about over the last few years who are just deciding to offer a primary care service. When we get to the point where we're not focusing on those individual players, I'm going to be really excited. I think that's something I will cheer on, because then we're talking about more of a holistic approach to primary care. And having that on-ramp be simplified, having there be less frustration in the early parts of a health journey. All I know is I'm not feeling well, right? So now the burden's on me to diagnose everything from there. And it's rarely, I don't know if anyone would describe that as easy. There are a lot of different options there. So it's kind of the flip side of having more choices in our care. So yeah, I think it just leads to a few different things. But I do see some signals that we're starting to think that way. And maybe it's because we're being forced to as an industry. And that's okay. Like whatever it is, we're having to ask ourselves more often, what can we do about the holistic approach to primary care? Are there ways? Are there things we can do? I do think the answer is partnerships there. Home care was the perfect example of clearly agencies and non-traditional partners who do feel like they have a strength and a service they can offer there to just get a little further ahead in that process. So can we think that way instead? Like, can we take the overall threat level down when traditional care is thinking about non-traditionals and just is instead of seeing everyone as a threat first, can we think as a potential partner first?
I think that tracks. And, similar to, who you're referencing there in the EU, when I was working in Canada, we were always talking about primary care and social service. And similar to certain countries in the EU, Canada, its health system is ultimately administered by the government. And those government ministries run primary care, social service, community housing, you name it. And so acute care is much closer tied to primary care and other social services. And so to me, that tracks. I remember when I started working in the US, everything was so hospital dominated, right? Hospital and physician dominated, where in Canada, it's all about primary care, nurse practitioners, and nursing. And so I think so much of it's cultural, right? And, I think earlier in the episode, you had mentioned maybe we should have to wait until a new generation shows up. And I wonder if that's part of it. Like when I think about, some of my colleagues and, what they're after in their career, it's ultimately to become a health system CEO. But these folks ultimately come up through, being the CEO of a hospital. But you almost never see like the urgent care service line leader or the primary care service line leader promoted to the highest level of leadership. And so I think to your point, some of this might actually be cultural.
I'm going to give you guys a twofer, but I'll be very brief. This first prediction is very nascent, but it'd be fascinating if it actually materializes and accelerates. And I'm describing it as advanced workplace health programs, where we might see our employers actually taking a more strategic interest in our wellness. And early indicators might be quality of sleep, which, again, not for every job, but we can imagine a bond trader or a surgeon needing a high quality of sleep. And it might behoove the employer to actually equip their team with a device that enhances sleep quality, like Whoop. There's many devices. So that would be an example of an employer-sponsored initiative to improve wellness. I would also point to mental health, where, again, an employer has a vested interest in kind of keeping you in a good state of mind. And there's also apps and services that could be employer-sponsored. Last one in that area would be a company that is based here in Boston called Neurable, which is pioneering a brain-computer interface. So think of headphones that essentially measure brain activity. And they're on the market right now. The first indication, if you will, is for focus and concentration. So it can tell you when you need to take a break, step away from your computer, step away from your task. And your brain won't tell you to do that. But by measuring brain activity, it can tell that you've reached an exhaustion stage. So again, that would be something that an employer might have an interest in facilitating. So kind of intrigued by that. Don't know where it will go, but it would seem logical that for certain health conditions, your employer, more than most, would have an interest in keeping you functioning at a high level. And the second prediction is based on some mentoring and advising that I'm doing in the world of precision medicine. And this is kind of going out over my skis. I'm obviously not a doctor and not a geneticist, but there's work underway in the world of precision medicine that is incredibly exciting in the world of fertility, in the world of oncology. All of our bodies are not the same. It would seem obvious. Yet today we're all given the same medications and the same treatments without thought as to how our genetics might suggest a different path of treatment. So genetic testing is definitely a thing. And I've been mentoring a company, not in the genetic testing field, but in the genetic counseling field, which is immediately adjacent to testing. And one of the major barriers to more testing being done, it turns out, is access to the counseling that needs to surround that test. The tests are incredibly complex. The geneticists who are prescribing them oftentimes don't have the time or the inclination to fully explain the implications of the test to patients. And there's a national shortage of counselors trained to do this. So it's a broken part of the system, which is getting in the way of precision medicine advancing and reaching its full potential. So if you're interested, the company that I've been mentoring, I'll give a plug. They're Toronto-based. It's called Genetic Advisors. You can find them online at geneticadvisors.com. And Dr. Yvonne Bouchard is doing incredible work to bring this solution to market.
Outstanding. All right. So Zain, our last round, it'll be somewhat of a lightning round, I suppose. So we like to predict either the brand or organization that we will be talking about the most in 2025 in healthcare. I have a bit of a different take on this one, and maybe it's just an area of focus or just I've seen a few things. But there was this recent announcement. I think we're going to be talking about a couple of GLP-1 brands in particular from Eli Lilly and Novo Nordisk. So Zepbound and Wegovy. And I was surprised just recently, just in the last few days, how much traction I've seen, how much attention I've seen paid to the results of a head-to-head test between the two GLP-1 drugs. And Zepbound had a 47% greater relative weight loss compared to Wegovy. It was a head-to-head clinical trial. And that meant, like, in context, it meant participants in the Zepbound cohort had an average of 20.2% loss in body weight, and Wegovy participants had an average of 13.7% of body weight. So just to put that in perspective, those who were in the trial, those on Zepbound lost an average of 50 pounds, and those on Wegovy averaged a loss of 33 pounds. Like both sides very significant, but I was just struck by, I saw it a lot. And I think it just spoke to where we are talking about GLP-1s. I just think it's going to start shaping different care delivery models when we talk about primary care. And especially when we start talking about things like subscription-based, membership-based primary care models. There was a stat I just saw from ZocDoc. They just released their What Patients Want, basically their latest report of how patients interact with care and what types of appointments they look for. And one of the fastest growing types of care, it was number 6 on their list of the top growing types of appointments that someone's requesting through ZocDoc, at least, was a diabetes consultation. It was number 6, at least for men. It was not the same for women. It was lower down for women. It wasn't growing as fast, but it was still growing, like super fast growing on each of them compared to a year ago. So I see that data point and think, yeah, we're going to be talking about them a lot.
That's interesting. I think for me, brands, and this probably won't come to a shock of anyone, but I still think like Amazon Clinic and Amazon Pharmacy, so Amazon in general, they're probably still going to make a lot of waves. And so, I think it's made less of the news because they're now squarely in the space, but they've brought on some new partners within their clinic model. They're, offering some other payment plans around Amazon Pharmacy. They're now more or less through their clinic model and pharmacy copying the Hims and Her play. And so I think there's still going to be a massive player in, and call it the low acuity, urgent / kind of primary care / specific condition provider that anyone in that space just is going to need to pay attention to. I think back to my earlier comment, I would just love to see, and maybe someone's listening can reach out and has the data or could help us, but to understand to what degree do some of these disruptors have market share relative to industry incumbents, I think is going to be fantastic to pay attention to. And if someone does publish that, I think you might finally see some incumbents start to move a little faster to at the very least mimic what some of these disruptors like Amazon Clinic and Amazon Pharmacy are offering their consumers. And so I think Amazon's still going to be something we'll be talking about well into 2025 and probably for the next few years to come.
In terms of what the solution or the app that we're going to be seeing more of in 2025, Jared, I'll give your employer a plug. You guys are doing incredible things. Priya Health,
yes.
Yep, in the world of experience orchestration. I'll also give a plug to listener of the show, Sam Searing, because I think the Epic app, it's not going away. If anything, it's going to become more and more of a dominant kind of part of our lives. And then, of course, anything in the world of AI. And I'm proud that we've not used the AI word more than we needed to today. But I think we're going to see more and more of ChatGPT and Gemini and Claude and all the other tools out there. We're still just scratching the surface of where that's going to take us.
Totally agree. All right, well, Zain, I think we're predictioned out at this point. We put it all out there. So whether or not we hold a keep us accountable episode or not, I think that I really appreciated the points you brought up and looking forward to seeing how it plays out in 2025.
We probably need just a Substack account in through written format. Just talk about some of our shows and compare and contrast some predictions and maybe turn it into a show itself, but give another place for people to follow along our content.
It's like we should have a community built around it too or something. I don't know.
Yeah, that would be good. We'll have to find a way.
Nice. Always a pleasure, Zain. Thanks so much for joining me.
Thank you, Jared. We'll see you soon.
Thanks, James, too.
Thanks, guys.